Hi there. We're doing something completely different today. We're going to cover Matthew Perry's memoir, which is called Friends, Lovers, and the Big Terrible Thing. We're covering that because that is a very inspirational story in our field of addiction medicine. Matthew Perry is one of the, I don't know if he was a reluctant pioneer in the sense that he was exposed, I guess, a little bit early in the 90s about, when he his first foray into rehab. Ever since then, he's been such a tireless advocate for treating people with substance use concerns as human beings. For me, somebody who makes their living telling their own story, he has been a real inspiration. We're going to look at whether this guy's gotten good addiction care. He's obviously somebody who has a lot of resources, and his own perspective is that he kind of didn't. I hope you enjoy it. Thank you so much. So this week, I brought forward Matthew Perry's book to discuss Friends, Lovers, and the Big Terrible Thing.
The Big Terrible Thing.
The Big Terrible Thing, yeah. And
what made you pick this book? I mean, there's so many memoirs out there. There's so many stories about substance use. What pulled you towards this one?
I guess there was a lot of parallels. I mean, he's the same age as I am. When I was struggling with my addiction, he'd come out into the media.
Well, he was one of the first ones, right?
Yeah.
Like we usually don't hear about all these celebrities and their addictions.
Right.
It's usually in the shadows, right? But this was public. Yeah.
Yes, public. Whether he chose,
in the 90s, yeah.
Whether he chose to or didn't, it was pulled into the public realm.
Yep.
I feel for him, and I think he's a really brave guy.
No, it is a really brave one, right? Because I like reading memoirs. I like hearing people's versions of their life and their story. And usually I look for lessons, right? I look for lessons of strength, resilience, all that stuff. And this one was, I was nervous about going through because I knew it'd be sad. And it's raw, right? And it just feels like this is a train of thought of someone, right? He's not trying to present himself in a good light, He's really almost putting a magnifying glass at his deficits. And it's very raw, and it feels very authentic.
In that way, it was hard to read for me.
Yeah. Yeah, no, I felt the same way. Like, it's one of those things, when I'm at work, it's more about having the person speak. And in the back of my mind, I'm thinking like diagnosis and recommendations and what the person wants and how to bring them on board with some things I might be able to help them or get them to consider it. When I go through memoirs or autobiographies or documentaries, I just feel the emotions intensely, right? And it's almost like you go on that roller coaster with the person, right? And so
for sure,
and so it was a bit, but I mean that's me as a clinician, right? And for you it'd be different because with a lot of substance use, the stories are parallel. Like there's a lot of, like, whether it's a relapse or whether it's the detox or whether it's the self-loathing or whether it's the unhappiness with others or whether it's the blaming yourself. Like it's just there's so many parallels in the story. I mean, every person is unique, right? So just like with depression or like any story is so unique, you can't really generalize. At the same time, there's certain things that will speak to us because they speak to the human condition, right?
Absolutely. And I mean, even I kind of have two lenses from it. One kind of the lived experience lens, and the other is sort of the armchair clinician saying, oh my gosh, what did they do here? And what did they do there? Right. And that, and again, we're listening to, his lens of this, his experience, it's his story.
Yeah.
So, but there's a lot of things in there that, quite frankly, would be, kind of questionable from, kind of classic training.
Yeah, and then this is where it does get tricky, right? Because who are we and where are we? We're in Canada.
Yep.
It's 2023.
Yes.
Right? And the world of addiction medicine is transforming rapidly,
yes.
Right? It's absolutely is transforming rapidly. But there are a couple of things in there that if someone was to hear it and take it as a gospel and not do their own research or reach out to a healthcare provider and they follow it blindly, it could lead to problems, and it might they might not be exposed to a treatment that could work.
All right, so why don't we've selected 8 clips from Matthew's book.
By this point, I knew more about drug addiction and alcoholism than any of the coaches and most of the doctors I encountered at these facilities.
I see a lot of people that could teach the sessions that I teach, right? So when I run a group counseling session on either to build up motivation, reviewing people's values, talking about behavior change, figuring out triggers, long-term consequences, the function of use, we have patients, clients, whatever the term is of the day, that could actually teach the sessions.
Sure.
And the challenge is that they still haven't mastered how to apply those skills and that knowledge. And they also haven't mastered it when the stakes are high. Right? And so when it's cool and calm like me and you are talking right now, they may be able to describe the things and do the things that are necessary. But when it's something that you care about that goes deep into your soul, it's harder to do that. And so for me, when someone makes a statement, I actually validate them on it, right? Because I've worked with so many people that could actually teach this. I work with people that have been in recovery for so many years, and they've coached all these people through stuff. I've worked with people that are therapists, right? That and then the relapse comes and all that kind of stuff. And so when you work with somebody who knows a lot, is competent, is capable, you can't just tell them what they need to do. Like, unless they trust you, unless they believe in you, unless you have a long history where they know you've got their back. And so you need to make sure as a counselor or a therapist that they know that you see their value. They know you see their intelligence, their competence, their capabilities. They know you have compassion for the suffering that they've been through. And then once they have that experience, there's a chance they may be able to hear your advice, but more likely it's an opportunity to get them to help design their treatment, get them to help design what they would need and how they would need it. And if you have that connection and trust, then you can actually call them when they say something that doesn't make sense.
Sure. I mean, yep, that all makes sense. I mean,
that probably wasn't where you were going at all, was it?
Well, I mean, you go where you go, I'll go where I go. I mean, where I would say it's somewhat problematic is that if the person in front of you thinks they know more than you, or you've gotten to the point where they've lost respect for you for any reason, then I think that makes that therapeutic journey much more challenging. And this is like if everything was going, if you, I wouldn't say this, but if you got everything together in such a way that you know more than I do and you've got all this, then why are you here and I'm here, right? And and if you don't need our help, then then that's fine.
Yeah. Yeah.
So let's get to the next one, which is a little bit more of a controversial point or an interesting science type point, which is now he's going to be talking about a medication that's near and dear to your heart, phenobarbital, and whether or not this is he had phenobarbital administered to him as a infant and as a newborn who was colicky, and one of his theories is that this led to
a lifelong difficulty with sleep.
Yeah. So let's play that now.
I mean, prescribing a major barbiturate for a child that's barely born and won't stop crying.
So in general, phenobarbital is a barbiturate. It works on the GABA and the similar receptors to benzos. It is used as an anti-seizure medication, and historically was sometimes used as a sedative hypnotic. Although because of the unpredictability in how the body processes it, the same dose can be processed differently, different times, and different side effects. They moved away from that to benzodiazepines later on. The real value, it has a very, very long half-life. And so in a lot of the residential treatment centers, when they detox people, phenobarbital is probably the one that they use they used to use for the multi-substances, right? So when someone's using 5, 6, 7 different things, a phenobarbital detox really allows them to get out of the system. They don't have a seizure, all that kind of stuff. It's used in kids as well, right? And so it's used for neonates, when they're born, sometimes to if there's some risk of some withdrawal or colicky kind of thing. His was interesting because it occurred on day, like, I don't know, like 2 to 6 weeks or something like that.
Yes.
And he describes where they almost had videos where he looked almost intoxicated or drunk, and everyone was sort of laughing in some way. I mean, he's right in what he says is that there's these windows, right? So there's these windows in development where different skills are developed at different stages.
Yeah, and from my perspective, I don't have the science background that you do, but from a common sense perspective, it kind of has a bit of a point here. I mean, it's a pretty powerful medication. You're giving it to some baby that's 3 weeks old. I know, it's.
I don't think they do it anymore. Like, I don't think it's not on the list of colicky baby medications. And
okay.
I don't know how common it was back then.
Thank you very much for that. That's great. So the next one we're talking about is his introduction to pills. So just to get some context on this, he's filming Fools Rush In, I believe, and he's on a break in between the filming. I think the movie's with Salma Hayek. And he's on a jet ski, and there's an accident on the jet ski. He has an injury. I don't know how significant the injury is, but there's a painful injury, and he needs to film an important scene. So they bring in a set doctor, and they offer him a pill, and the pill happens to be Vicodin, and this is his first Vicodin. So this is a little clip about that.
Called the doctor, who came to my trailer and handed me a single pill in a plastic package. Take this when you're done, the doctor said. Everything will be fine. I stashed that pill in my pocket, and I swear to God, I think if I'd never taken it, none of the next 3 decades would have gone the way they did.
Within 18 months, he's at 55 Vicodin per day. And I think he goes on to describe a scenario where he felt it was his connection to God. The pill made him feel that good. I think it was warm honey going through his veins.
No, this is a really sad part of the story for me. And there's a lot of people that unfortunately went through that. Opiates, for some people, he describes it as warm honey. Some people, they just get such a sense of peace, and calm with it. It's like all the trauma and stuff disappears for a moment. It's more common in people that have been abused early in life, and back when we used to prescribe meds for pain and there was a signal, maybe there's an addiction coming, they had a risk tool they used to use, right? And if you have a family history, I think, of mental illness, if you have a personal history of sexual abuse, like, it makes you very vulnerable to developing addiction to opiates. And while some people, they take the opiate and then they get nausea and they feel sick and all that stuff, other people, they're in peace and calm. And there's a scene in Basketball Diaries with Leonardo DiCaprio that has just stayed with me. Like, there's a scene where he's like screaming and like crying and upset, and there's a scene where he uses, and all of a sudden there's like peace and calm, and it's one of those things. I mean, before this, it was mainly alcohol, and I just it's so sad because. Even though it happens to some people, they have that one pill, and then all of a sudden they experience something, and they're just constantly trying to get it again, right, to fill whatever that void is, and unfortunately, one of the unintended consequences of making pain the sixth vital sign, the consequence of trying to treat somebody's physical pain, was that we had a larger subset than we thought, I say we, but I mean the medical profession as a whole, who just got dependent on these pills. And then it was the only thing that could give them the emotional relief.
Yeah.
And
I think, sorry, go ahead.
I was just going to say that people can get some of that relief from real life, but it doesn't happen that immediately and quickly. Right. And so, that's all. It's just sad. I mean, the whole iatrogenic addictions that were caused by doctors giving pain meds is very upsetting to me. And I worry constantly that is there something else that we're doing that's going to have that kind of harm on society as a whole?
Yeah. Me too.
Yeah, I worry a lot about that.
And I think that's, so as I think the story went, and forgive me if I get any of the details wrong here, but I think he called back the doctor and said, this is perfect. He didn't tell the doctor it was a godlike experience, but this is perfect for my pain. Yeah. By the next morning, there was 40 Vicodin delivered to his hotel room. And there you go, right? And now, would that 40 Vicodin have been delivered to his hotel room if if it was one of our patients.
Well, I never prescribed Vicodin. I wasn't around at that time.
There's,
but
did we have Vicodin in Canada? We didn't have Vicodin in Canada, but it's a similar let's just call it the equivalent of it.
Yeah. Yeah, I think, when you have funds, you get better care.
Better?
And well, maybe not in this case, I don't know. But it's, if you think about it from a pain perspective, somebody has pain, he had some injury, the medication worked. It's not unreasonable to give it a little bit more.
40?
And you can't predict when an addiction is going to take off. And in fact, in the early 2000s, there was tons of papers saying that if you have a legitimate pain condition, you won't get addicted to opiates. There was tons of papers saying that. And, it was just, and what are you supposed to do as somebody you're trying to follow the guidelines, you're trying to follow the practice. In Ontario in the 90s, I think, you would get in trouble for under-treating somebody's pain.
Yeah.
You would get in trouble for that, right?
All right. So I'm sorry, I'm going to keep holding you to get an answer on this, though. It's like, so 40 is a reasonable number?
Yeah, I don't remember what injury he had.
It
was something where
fell
he
off
had a jet ski
fell off
accident.
his jet ski. One gave him relief. Did he need to get 40 in this as the follow-up script?
Now he wouldn't get that much.
Okay. Well, I don't have a problem saying that. To me, it sounds like it was an overly generous script.
Yeah.
There was some risk involved in the script.
Yeah. So.
All right. So the next one is very much in our addiction medicine wheelhouse here.
Yeah.
So and this is a somewhat controversial statement that he's making. He's talking about buprenorphine.
It's a partial opiate agonist, and what makes it really, really special is that it's hard to overdose on it. It binds super, super tight to the receptor, so it knocks the other stuff off. It binds super, super tight, and it lasts for a really, really long time. And it's got a ceiling effect for respiratory depression. So say if I'm sitting here and I take 1, 2, 10, 50 morphines, I'll stop breathing. But if I take 1, 2, 10 buprenorphines, my breathing rate will lower, but it won't stop. Yeah. And this is a different time than when he was taking it. But now we love it when people are on this medication because they're very unlikely to die from an opiate overdose when they're on it.
So where it's somewhat controversial is he sees this medication as what he calls a detox medication.
Yeah.
He makes a further statement, says nobody should be on this medication for more than 7 days.
Yep.
And this is controversial because we have patients that have been on this medication for years and years.
Yeah.
And alive. And doing well, but he brings up some very valid points, right? So he says that this impacts his his being, right? It's not a good life. He says it's the hardest thing to get off of.
The World Health Organization, the Canadian, the American Society of Addiction Medicine are very clear that detoxification is not treatment for it. In fact, it's contraindicated. So what does that mean? That means that if you have an opiate use disorder, going into detox and getting off of opiates is not best medical practice. But why would they say that, right? Because we always talk about detox. We talk about that as part of the addiction treatment. And what happens with people who use opiates is that about 80 to 90% within 1 month will relapse, above 90% over the course of 6 months or a year. And then what happens to people is that they lose tolerance. And then they'll go back and use maybe a similar amount, and maybe they'll use alone, and then they'll die, right? Because their body's not used to it. And so we really recommend opiate agonist treatment, right? So methadone, buprenorphine in Canada, we use something called SROM, slow release oral morphine. It's illegal to use that in the States due to the drug regulations for it. Mm-hmm. With buprenorphine, in fact, when I started practice here, there were a lot of treatment programs that would not take people on buprenorphine. What he describes is his experience, right, around feeling empty or dead inside. That's not the experience I've heard with buprenorphine. We might have to get some papers to hear patients' narrative on it. But I hear very different stories on it, and usually when somebody feels dead, on it, I have to unpack that quite a bit to really figure out in the narrative what's actually going on. What would be the addiction medicine treatment? What would be the psychiatric treatment? What would be the psychotherapy treatment? What would be the behavioral treatment?
Okay, so here is the quote for his buprenorphine.
But I felt nothing. I couldn't tell if that was because of the opioid buprenorphine I was taking, or if I was just generally dead inside. Buprenorphine, for the record, is a detox med and an excellent one, and is designed to help you stay off other stronger opiates. It does not alter you in any way. But ironically, it's the hardest drug to come off in the entire world.
So this next quote is about, which you brought forward, talking about smoking and having, wanting to break his record of 15 days. So that's number 5.
I had a record I had to break, 15 days. And with that would come the cooling comfort of not wanting to smoke. I've been there before. I could do it again. The complete rebuilding of a man.
So the reason I picked this quote is that, a lot of people don't know this, but smoking is probably the most addictive drug. About 1 in 3 people who smoke do become addicted. I think with heroin, it's something like 1 in 4. With alcohol, maybe 8 to 10%. Same thing with cannabis. And smoking is probably the most addictive drug. And the other reason that I liked it was that he talked about in the paragraph after that one about how he was much kinder to himself after those 15 days. He stopped being so self-critical, stopped being so judgmental, and it really allowed him to build himself up. Sadly, when I was going through this book, it was hard to find examples of resilience and strength, and nobody lives with an addiction as long as he has, without having those characteristics and traits. And I think that was where maybe it was a mistake. He really slipped in a point where he shows that there is some resilience and strength in him. And I wish he allowed us to see more of that in his writing.
I agree with you there. I thought there was very few, even, his honesty was it felt very self-deprecating and he was very hard on himself, and he has been through so much.
Yeah.
And he doesn't give himself any of the credit that he needs to give himself. And that's just my opinion on this, but and that was an opportunity to do it. And absolutely, nicotine is just this almost impossible thing for people to seem to move forward from, right? It's the last thing people move forward from, but in his case, he needed to, because it was, I think it was an impedance to other problems medical problems that he was having at the time. All right, so the next one is, again, this is kind of tying into the money situation. So I believe he flew to Switzerland for care, and this is where it was in rehab in Switzerland, and was explaining to be in pain, and got up to 1,800 milligrams hydrocodone, which is similar to a previous video that we did talking about tolerances. And in addition to the hydrocodone, he was also on, I think he was on some benzos as well. I'm not 100% sure that, but he was definitely on a ketamine.
Yeah, they would give a little bit of a Ativan when they did the infusions.
Okay.
And he felt it.
Right. Okay. And so this is, and then he was on the ketamine. Ketamine infusions as well. So ketamine is a drug that I have a lot of experience with personally. Not in the current context of it's being kind of rolled out across North America in various clinics right now.
Yeah.
Various psychiatry-run clinics are getting big in this for treatment-resistant depression, I believe.
Yes, yeah, no, absolutely. And I hope it goes well for it. The data looks good so far, but we'd argue it's still in the experimental phase. It makes me wonder, their protocol in Switzerland, the rationale, because the way he describes it, it was almost like a mental break from himself. He would go there, you'd have the ketamine and the hydrocodone. It was interesting. One of the stories involved him being in Switzerland, coming back to California to see his doctor. And he was told in Switzerland the doctor would just continue the 1,800 milligrams of hydrocodone. And the new doctor said, no, I don't do that. You're getting 30. And then immediately spent $175K, flew back to Switzerland to get his hydrocodone and his ketamine infusion again.
Yeah. So he's in treatment at it has a private chef, and there's no other kind of co-clients in the treatment center in Switzerland, I understand, and he's on 1,800 milligrams of hydrocodone. He's on a ketamine infusion, and he's on a benzo as well occasionally. Wow. And I can't see a scenario where one of our patients would ever have the ability to have that.
Well, it's not even necessarily about the ability. I mean, in all the exams that I've taken, I've never seen that as a treatment option. Some people believe it's the ketamine itself that helps with the treatment-resistant depression. Maybe they were using those protocols there. The way he described it, it didn't sound like it, that they were using those protocols. And let's see what happens. I think there's a lot of promise and hope for the ketamine-assisted psychotherapy, ketamine's treatment for.
And I'm probably not as generous to your to the medical colleagues, your medical colleagues in Switzerland. I would suggest that probably that wasn't exactly the best care.
Yeah, and
that's okay. You don't need to have an opinion on that.
But like when people have unlimited means, right? When you have unlimited means, like everyone's gonna, I don't know how to explain it. It's almost like even if as a therapist, right? If I've got a patient that's coming in a couple of times a week, but they're not getting better, it's subconsciously or it's in my benefit to have them keep coming in, right? Like it's a form of income, it's a form of all that stuff, and it's a tough. I don't know.
But there's no evidence to suggest that you're not going to break through on the second week or the third week or the fourth session or the seventh session. If you knew it was hopeless, I mean, I know because I've worked with you in a practice. There's, you're not going to,
I haven't seen the randomized controlled trial where a flight to Switzerland and getting infused with ketamine and hydrocodone because you're unhappy at what your doctor prescribed is the best practice or treatment.
All right, that's as close as we'll get you. That's okay.
I hate. I don't want to. I want to give love to everyone. I don't want to give hate and stuff. But I truly believe the wealthy and the people that we see get shitty addiction care. 100%.
Okay. I'm less hateful of being critical.
Maybe that's why we work well together. I can be like, maybe they were trying to help the pain. That's why they kept prescribing.
Sure. I'm sure that definitely. All right, so the next one is very much in your particular wheelhouse because this is he attributes one of his, if not his final sobriety, to a therapist who tells him that to think of next time you think of OxyContin, think of having a colostomy bag for the rest of your life. So let's play that.
One day, God and my therapist got together and decided to miraculously remove my desire to take drugs, a desire that's been plaguing me since 1996. My therapist said to me, "The next time you think about OxyContin, I want you to think about living the rest of your days with a colostomy bag."
So my question to you then is fear a good therapy tool? Is that a long-lasting evidence-based approach to getting people to stop using?
Oh, I love how you focused me because I had like 5 stories that were loosely related to that I wanted to share. I was gonna talk about your moment of recovery. I was gonna talk about how sometimes it's not what's said, but there's sometimes a message is delivered in such a way where it's like it just hits you. It just hits you, and then it's not something new, but it just hits you in a way where bam, it's time to make a difference. The psychological literature is I believe, is really clear about this. And I think fear is a phenomenal short-term motivator. I don't know what short-term means. A day, week, a month, a year, 5 years, 10 years. But if you want sustainable change, you're going to need a long-term vision that you're moving towards.
Yes.
And so for example, somebody has a seizure, they're withdrawing from alcohol. Somebody has a situation where they black out and do something that they regret. You usually for a certain period of time, they're able to not even think about it. It's what is that, like college stereotype, where you people get drunk and they're puking, oh, I'm never going to drink again, right? Yes. And then maybe they don't drink for a day, maybe they don't drink for a week, maybe they don't drink for a month.
Yeah.
But then there's like one thing, oh, maybe I can have a bit, right? And so the shittier thing that happens, probably, I mean, I'm generalizing here. Chances are it's going to be a long time that people avoid something, and for him, he's so lucky to be alive. The rupture that he had kills most people. He just happened to be at the right place, for it. In the long run, as human beings, because now that we have a podcast that has 500 subscribers and one video that has 40,000 views. I was looking at these podcasts and how they evolve and develop. So they'll have a topic, then they'll go on to something else, and they'll depend on what their audience wants, right? But eventually, they're all about self-improvement. That's what it goes, like how to be better, how to get better, how to help people get better. And it fits perfectly with this, because in the long run, you need something you're moving towards. You need something meaningful, something that gets you up, gets you going, all that kind of stuff. If your day without drugs is not more rewarding than the time that you use, you're going to be at risk for going back. You're going to be at risk going back for that, right? Because I believe the fear only lasts for so long. But although for some people, the fear lasts a really long time, it can last a lifetime even. You
can be scared of a lot of things. As someone who's been in an ICU 8 times, death wasn't not something that I was scared of. It was not about if I would die from this. It's just when I would die from this. Right? It was There was no question about it, because I never thought of a time. My journey was completely different than Matthew Perry's. I never came down from these drugs. I never stopped. I did it every day. I didn't have any false starts. I didn't have any
you didn't have any
detoxes,
addiction treatment. Any traditional addiction treatment.
Any addiction treatment at all.
Yeah.
But when I did stop, what needed to happen at that time was the underlying problems that was creating the need for me to use these substances needed to be addressed. And if it wasn't starting to get addressed, it was inevitable that I would use again, but at the same time, I did have a caseworker helping me get housing. I did have somebody helping me get legal aid, helping me, get back on my feet, helping me with the unmet needs in my life. And if that didn't happen, then I'm 100% certain that the sobriety would have been short-lived.
Yeah. So there's 3 things now, right? There's the fear of the horrible thing that you don't want to happen again, or you don't want it to get to that point, or you never want to be in that situation. There's where we're moving towards, and what you said was the how you get there.
Yeah.
Right? Because sometimes we know the steps, but we just can't do them. We need someone to be there with us, right?
Yes.
And so there's the steps how to get there.
Yes.
The other thing that I wanted to bring up that he brought up a couple of times, which I think he was very fortunate for, there was something in his story where he decided early on that he would never do heroin.
Yes.
And, I'm grateful that he never did heroin.
Yeah.
Right. I'm grateful because that show brought so much joy to so many people. And I'm sure, even though he doesn't share in his stories, I'm sure his existence brings joy to so many people that are there. And the way that his brain responded to the Vicodin, I don't think he would have had a chance if the heroin had.
Sure.
Right. So good for him in terms of having that one principle that he made sure he never got by, because,
So I think it's if it's coming down to 2 words, it's fear is okay, and fear and hope, right? So if there's no hope, there's got to be hope, right? If there isn't hope, I don't know what would stop somebody from regressing back. I just don't know. I don't know of anyone that's been successful at it that has no hope for moving forward.
Yeah, and that's why I think some of the things that he's said, might be true. And I wonder if they're helpful or not, right? And maybe there's a way to find a truth that's also helpful. So, for example, if you go into a treatment center believing that you know more than everyone, right, that there's nothing you can get out of it, where's the hope in that, right? If you believe that your brain is broken and there's no chance of it getting, where's the hope in that? And so we and there's therapies that do this. There's therapies that help us come up with beliefs that are still authentic and accurate, but also helpful.
Okay, so the last quote here is going to be, probably more controversial than most.
And so you're going to get no opinion from me, or you'll get a weird opinion that everyone's going to be upset by.
Let's see.
Oh, okay.
Here we go. You ready?
Yeah. Most of these places are pieces of shit anyway. They're hell-bent on taking advantage of sick, needy people and cashing paychecks. The whole system is corrupt and completely fucked up. Take it from me. I'm an expert. I've poured millions of dollars into this system. Did the money help me or hurt me?
In my opinion, it's just my opinion, there's a money-driven element to care, and I would imagine that the person with the most money would not do the best, and that's sad, right? In this field, I'm sure, notwithstanding, let's say he had
maybe a heart disease,
if it was cancer or something, then that would be perhaps different. But in this particular type of thing that we work in here, this addiction stuff, this money is could be a curse.
Yeah, I mean, I don't know. I mean, I just the whole idea that when you're unhappy with what a doctor prescribes, you could take a private jet immediately to Switzerland and get whatever med you want.
Yeah.
Like just that ability shows that maybe the money wasn't the best thing, for him to have that unlimited supply. But I don't know.
Yeah, I mean, I have no problem saying that money has, I'm not going to say that the system is corrupt and it's at its core, but I'm going to say that, I have no problem from what I've read, from what he shares, if and I take him on his word here, that, money has corrupted his care. And, you just have to look at the Switzerland example, right? There's no, everything else, maybe other things are murky, of course, and we're getting one side of this, of course, right? But if the facts are as he represented it, it's my personal belief that money was not his friend, and in this situation, and I feel. I feel bad for the guy,
I feel so bad.
Yeah,
It
I mean, it is a sad story,
hard
and
to go through, yeah.
I mean, I just not that he's listening, but I just want to thank him for being so brave to put this forward, because this is not something that, as somebody who tells, I'm in the addiction world, this is what I do for a living, and I still struggle with telling my story at times, and I'm not a movie star, I'm not I'm not Chandler, and and it's so what he did is very brave, and what he continues to do is very brave. So I think that needs to be commended all by itself, because he's certainly wearing this. And he doesn't need to do this, right? He doesn't need to. He didn't need to write this book at all.
He didn't.
So I'm glad that he did, and I'm glad you joined us, and that's all I got on this.
Yeah, no, I don't know much to add, but I feel the same way. The amount of courage it took to put something like that out there, to be vulnerable, knowing that people are going to perceive different statements in different ways, and this is somebody that strives for excellence, right? And to put that the flaw right there that everybody sees first is quite a thing. I hope he's able to find the love and care and the support that he needs, and hopefully someday he sees. Hopefully someday sees the impact he's had on others, because it's brought so much joy into so many people's lives, with the shows and stuff that he's done. So
100%. Okay, thank you.
What time is it?